Y'all stressed because y'all in nursing school. Y'all have an upcoming exam. And you are dreading this exam. And because of the fact you're dreading this exam, now you have diarrhea and maybe a little bit of a panic attack. Is that local or general? Stress. When it comes to stress, make sure you know the different types of stressors. Stressors can come from different chemicals, so medications that you may be using, like cancer treatments, for example, those chemo medications, those are examples. Infectious agents, nutritional imbalances, hypoxia can also be a cause of stress, or some disorders, whether it be genetic or immune, are all examples of physiologic stressors. These are things that cause stress on the body and how the body functions, right? So, some examples of psychosocial, mental stress could be accident. Yes, you had an accident. We're going to be stressed, especially during the initial impact. Stressful or traumatic experiences, horror histories, like the, what happened with the Jews? The Holocaust, okay? Fears of aggression or mutilation, rapid changes in the world, like COVID. COVID done changed everybody's life. We was all isolated. I can't go see my parents. And then inherent stressors. So you need to see what are some factors that affect a person psychologically. All right? Remember we talked about it earlier. The body's always fighting to be in balance. You cannot forget Dr. Sullivan on this one, okay? Okay? You must know the different types of physiologic balance. You have local adaptation syndrome versus general adaptation syndrome. People do not play with me on this. Local involves only one specific part of the body, okay? One specific part of the body. Pay attention and read that question carefully. So let me use y'all as an example. Y'all claim y'all stressed because y'all in nursing school. Y'all have an upcoming exam, okay? And you are dreading, I don't know why, but let's say, it's not y'all, but dreading this exam. And because of the fact you're dreading this exam, now you have diarrhea. Okay? And maybe a little bit of a panic attack. Is that local or general adaptation? General. Why you say general?
Because it's mental and then your GI.
So more than one part of the body is affected, right? General adaptation, now you must know it goes through different stages. Does it show? Okay. Let me go back a little bit. With general adaptation, With general adaptation, you start off with the alarm reaction, where you are introduced to the threat. Then you go into the stage of resistance, okay, where you're compensating and dealing with the stressor. And then the stage of exhaustion, where you have some stage of relief, right? Now, with regards to general, you must know you have the threat. The threat goes into an alarm reaction, and then you have elevated physiologic response. Your heart rate starts to increase. Your blood pressure increases. Your pupils get dilated. Even your glucose levels might be increased, just like how Sophie said earlier, because the body responds to stress. One of the methods is through elevated glucose levels, right? Then now you are alert. There is an increased mental alertness, but you focused on that stressor, whether it be a dog running after you or something or whatever, okay? Then after that, you go into the stage of resistance, and notice what happens. There is neuroendocrine activity that returns to normal. Your body now, what was once elevated at some point, now is starting to decline, right? Your heart rate starts to decline, blood pressure starts to decline, etc. Now, after that, you go into, after stage of resistance, you can either go into recovery, Or if you don't recover, you can go into the stage of exhaustion, where now you're like fatigued. Okay? Simply saying. The state of exhaustion the body responds to the stage of exhaustion via vasodilation. This is now when you see the blood pressure lowers, heart rate increases, and there could be either a panic or a crisis that take place at the stage of exhaustion, right? Now, after the stage of exhaustion, one of two things can happen. You either rest and recover, and we are happy, or the client dies. So that can take place. That's what happens with general adaptation syndrome. This is why when the patient is in any type of stress, whether it be local or general, you are closely monitoring this client and providing effective treatment as soon as possible. You cannot delay care. All right, there was another thing. Now, with regards to local adaptation, I'm gonna go back a little bit. I said it does involve only a specific body part, such as an organ or a tissue, or instead of the entire body. But there's two types of local adaptation syndrome. You have the reflex pain response or the inflammatory response. So that basically means your body is either swollen or you in pain. And sometimes people experience both of them, okay, depending on the situation. All right, are we cool on local versus general? We're good? All right, I said all of this. Now, you have to now also assess how the client copes with these stressors. People cope differently, okay? So coping mechanisms include crying, which is a normal response. People also laugh. I had students, I was like, why are you laughing? Because you scare me. I'm like, okay. I mean, do you see me scaring anybody, by the way? No, see, I don't know. Like, I had students that are laughing all the way. I'm like, okay, let's calm down, all right? Some other people cope by sleeping or cursing. When your client is cursing up a storm, just woosah. Just let them curse. Long as they're not attacking you physically. Now, they might call you out your name. That has happened. Okay, just hopefully you have the understanding to know it's not really you. It's really the client dealing with the situation or situations. And this is how they are coping. Okay? Another coping mechanism is they go out and run. Some people will go out and run 5 miles, 10 miles, or whatnot because of stressing, to deal with the stressor. Some will smoke, some will drink, some will withdraw and isolate themselves. They may lack eye contact. Now, lacking eye contact does not always mean that it's a coping mechanism. Sometimes it's a cultural factor. I just want you to pay attention to the lack of eye contact. There are certain cultures, they will not look at you in the eye. Okay, I had to learn this. Like with one student, I'm trying to talk to the student. The student like, look at me, I'm talking to you. They're like, that. I had to realize, oh, that's your culture. Okay, let me let this be. Does that mean that? Do you understand? Okay, and then of course they limit their relationship. Now, task-oriented reactions to stress. Some people they may attack as a result of dealing with the stress, and they may withdraw or they may compromise. Okay, they may be like, okay, if this happens, then I might do that. Okay, or whatnot. This, don't play with me. You must know the defense mechanism up until you take and pass NCLEX on the first attempt, because it might show up. Okay, it might. Just might. Now, what you do with that information afterwards is what you do with it afterwards, okay? But just for now, I need you to know the defense mechanism. Compensation. What does the book say is compensation? Quickly, real quick. Let's go so we can, because I'm trying to be MIA. Let's go.
A person attempts to overcome a perceived weakness by emphasizing a more desirable trait or overachieving in a more comfortable area.
Okay, English, because I have no idea what you just said.
A student who has difficulty with academics may excel in sports.
So, what does that mean?
So they focus on sports.
Focusing on the good to make up for the bad.
Right, exactly. Okay, you understand?
Yeah.
You're not good at one thing. I'm not good in school, but I'm damn good in sports. So that's compensation. What is denial? Y'all already know what denial is, okay? They told you have this and you denying, I don't have nothing. You don't know what you're talking about. Now, displacement, what is that?
To feel out of place.
To feel out of place. That's what is displacement, or you just guessing? She guessing. She just wanted to feel like she was saying something. What is displacement? What does the book say? Is she correct in saying displacement is to feel out of place? Is that what the book say? No? Damn, you see? And when I put that question in on the exam, and then you'll be like, but Dr. Sammy, displacement means, okay? What does the book say is displacement?
When you transfer an emotional reaction from one object or person to another object or person.
Snowball effect.
Give me an example.
I did really bad in school, and so I went out to my car and paid my car.
You understand? So you didn't get the grade you wanted on an exam, not tomorrow's exam, you're getting a grade.
Oh yeah, okay, great.
And not this semester. Let's say, I don't know, some time ago, because we ain't calling, we trying to get out of here at a certain designated time. So, you know what? Let's say somebody said something to you. Your classmate said something to you. You didn't like what your classmate said to you. You didn't take it out on your classmate. You know what you did? You went and go hit your car and bust the windows of your own car.
Oh,
That's okay. Let's not try to catch an lawsuit or criminal charges. Okay, does that make sense?
Yeah.
So you're displacing
My own car. What if I would have busted their windows?
Okay, I mean,
Would that still be
is it still displacement at this point? If she busted the person, it's still displacement. You didn't deal with them.
Okay.
It's still displacement. Yes.
So like, would it like a more like a clinical example that would be the patient that's like taking it out on you, like they're displacing how they.
Yes, good example. Good clinical example. The patient was diagnosed with terminal disease, so they take their anger out on you and curse at you. Okay, that's displacement. Good example. Give us a sticker, man. Give us a sticker box. Okay. Good. Now, introjection, real quick, because I don't want y'all playing with me on this one. What is introjection? What does the book say is introjection? Speak on the TikTok trying to pass the exam too.
The person incorporates qualities or values of another person into their own ego structure. This mechanism is important in the formation of conscience during childhood. So for example, an older sibling tells his preschool sister not to talk to strangers, expressing his parents' values to his younger sister.
So it's almost like good role modeling, sort of. Okay, that's introjection. What about now projection?
About disassociation. About disassociation.
Oh, damn.
Oh, I thought you skipped that purposely.
I didn't, but I did forget it. Okay, we're come back to what is projection? What is projection?
Person attributes thoughts or impulses to someone else. So for example, a person who denies any sexual feelings for a coworker accuses them of sexual harassment.
Does that make sense? Because I don't want you to confuse it with displacement.
That's a bad example.
With the sexual harassment?
That example isn't good.
Why?
I don't know. It doesn't.
Because you don't like the sexual harassment?
It doesn't make sense.
So if
Okay.
you're being blamed for something, they flip it on you.
Read it again.
A person who denies any sexual feelings for a coworker accuses them of sexual harassment.
Oh, what is this? This is projection.
Yes.
Projection.
Okay, this is like a good example of this is like a man who's cheating on you is gonna accuse you of cheating on them.
Yeah.
They're projecting.
That's
Well,
what
I mean, yeah.
They're projecting.
Projecting.
Or like somebody who like is really insecure about themselves. They're like, oh, you're ugly.
They're
No,
bullying
just
you.
think you're
Yeah,
ugly.
they're
Yes,
projecting
and
their
it's really
feelings
what they're
on
feeling
you.
inside, internally, or what they're doing, but now they're putting it out on you,
So they're putting the internalized stuff onto that
on
person.
the next person. That's what projection is.
They're not
Yes.
displacing it. They're
Not
just-
displacing.
they're just
Displacing is
turning it
different.
around,
Huh?
like flipping the story.
Projection is kind of flipping the story, yes.
What was introjection again?
So what is the good role model, right? The introjection, yes, something a good behavior that I learned, and I role model it to the next either nurses or, well, I said nurses, but you know what I mean. Next person, the next younger people. Okay, for example, rationalize. That's pretty much self-explanatory. Like, for example, I'm making an excuse for why I do what I do. Okay, I gotta drink. Drinking alcohol keeps me lit, so I need to drink, and I don't drink, by the way. Okay, or I need to do this dangerous activity because it is good for my health and well-being, knowing very well that it is not good for you. It's not a good activity, okay, to do. Then you have, what? I'm getting tired of this. Reaction formation, you're just forming a reaction to whatever event took place. Regression, which you need to know, and you're gonna see regression a lot, especially when you do PEDS, but what is regression? You return to earlier stages. Like, so the 10-year-old child who is potty trained right now, because they are now hospitalized, now become incontinent or suffer enuresis, for example. That's regression. You're going backwards, right? Then you disassociation before Crystal get at me. What is that?
Kind of removing yourself.
Huh?
Kind of like removing yourself.
You don't sound like you sure. What does the book say? Because you sound so unsure.
I sound unsure.
Oh, yeah. Huh?
Person subconsciously protects themselves from the memories of a horrific or painful event by allowing the mind to forget the incident. So, for example, an adult cannot recall childhood memories surrounding the traumatic death of a sibling.
You forgetting the event.
Oh, it's like dissociative amnesia.
Well, you can put it that way, yeah.
Okay.
I mean, if you want to be very specific, but yeah. So in other words, dissociation is you suffered a traumatic event, you are dissociating by not remembering that event.
Or not responding.
Or not responding to it, yes,
So
okay?
in the hospital could be traumatic and so they may just shut down and just disassociate.
Yes, okay, yes, all right? And then you have, what's sublimation? What is that?
A person substitutes a socially acceptable goal for one whose normal channel of expression is blocked. A person who is aggressive towards others may become a star football player.
Does that make sense?
No.
Okay, let's say for example, I love starting fires. I have a fascination with fires for whatever reason. That's kind of a negative thing. So instead of going around being pyromaniac, okay, I am a firefighter. Does that make sense? I love cutting stuff.
So Dexter.
Okay, let's say it's something about the knife that's like, ooh, and then when I see blood dripping from the knife, so instead I become a surgeon or I become a butcher. That's the butcher's better. Butcher's better. Now what I'm butchering meat in the store factory or something like that, because it could be taken out of context too. Does that make sense?
So it's like doing something.
You have a bad habit, but you turn that bad habit for useful societal purposes. Does that? I don't know if that makes better sense. If I like cutting, instead of cutting people for whatever reason, I actually go become a surgeon.
So like it gives you an excuse to do it without the negative
impact. I don't want to say it gives you the excuse, but yeah, it just you're using this. Can I call it talent? I can't call it talent, but this bad behavior for the good of society. Okay? Huh? What's Dexter? I never heard of Dexter.
That's why I said you never watched Dexter.
No.
He's a serial killer, but his dad raised him to use his urges to kill people, to kill
Bad people.
Oh, and what he does? So he's an actual serial killer.
So he's a serial killer that kills only
but he only kills bad. So no, because he can still go to jail. So no, not Dexter. He's a serial killer. Yeah, no, even though it's getting rid of bad people, no, okay? So no. But now it is important that you do know what these defense mechanisms are. People will use various forms of defense mechanism to deal with their current health situation. Okay? Let's keep it moving. Now, we must know what impact stress has on the individual and those surrounding the individual. So, of course, when it comes to stress and meeting the basic human needs, it can, for example, let's say the patient or the person came, they had an accident, okay? There goes a stressor. Now they have a panic attack, okay? Basic human needs that must be met now is probably oxygen, because now their O2 might be low, their respirations might be elevated, etc. They're not breathing well, so they have inadequate tissue oxygenation. So we're going to make sure we meet that need. Like give them, here's a brown paper bag, let's calm down, apply O2, etc. Right? Then there is stress in health and illness. There's long-term stress, family stress, and crisis. You have to know long-term stress. That's when it's a problem. Everybody stresses out. As long as you are above ground, you are going to experience some level of stress. As long as you are above ground, you're standing on your 2 feet above ground, you're going to experience some level of stress. Stress in and of itself is not bad. It's how you respond to that stressor that may be the issue. Okay? So if it's long term, it's going to have a negative impact on your body physiologically. That can increase the risk of infection, for example. Okay? All right, in the interest of time. So, family stressors, of course, changes in the family structure and role. Let's say it was mom, dad, children. Dad was the primary breadwinner. Mom was to stay at home, taking care of the house and the children. Dad gets a stroke. Now mom is stressed out because now mom has to take on dad's role and become the primary breadwinner, take care of dad, and continue to take care of the home and the children. Can you see how mom is stressed out? You understand? So that's what you got to look at. Angers and feelings of helplessness and guilt. Loss of control over normal routine. If a patient, again, let's use dad who is stroked out. Dad was a hardworking man, doing everything he needed to do. Now he is stressed out because he can't go out and work. He can't go out and play football or golf and fish or whatever and work or whatnot. So now he has loss over control and he is now feeling terrible and also helpless. He may also feel angry too. You understand? So that client may feel multiple stresses at one time. And then concern for future financial stability. So actually, everybody can, not everybody, some people can actually go through all of these stresses all at one time in one event. Okay? We already talked about the factors affecting stress, the sources of stress. This you gotta know. Developmental stress, real quick. Developmental stress is stress that occurs because of the stages of life. For example, I almost experienced developmental stress because my oldest graduated high school happy and he wanted to go away for college. As the typical Caribbean person I was like, no, you're staying here, okay? But if he did go away to college, that would have been a developmental stress. Does that make sense? Or let's put it in a clinical setting, right? Let's say this client was working their normal job and got a promotion at the job. They were happy, but that job promotion was now more stressful for them. And it could impact them physiologically. So because of that, now their blood pressure is high, they're chronically, constantly tired, etc. Does that make that's a part of a form of developmental stress because of a progress in life? Does that make sense? Marriage is another one. Okay, for example, okay, stages of growth. Situational stress now is an event that happened that was unpredictable.
Like the injury.
Injury. Oh, I put marriage or situational. I take back the marriage. Marriage goes under situational. But like an accident, that's an event. I don't know why marriage or divorce would really be situational, but whatever. Okay, role change, those are situations, okay? Then, all the other ones. Okay, that was it for those type of 2 stressors, okay? I was about to talk about something else. Now, we as nurses know that you will endure stress for the rest of your professional life in some way, shape, or form. It's just how you deal with it that's more important. But some of the sources of stress for nursing profession is assuming a responsibility that you weren't prepared for, like you came in to be a regular staff nurse, and then out of the blue, because you got your BSN, they say, hey, you are the charge nurse tonight. And you're like, huh? And you're like, yep, here we go. That's a source of stress. That could happen, okay? Working with unqualified personnel, that goes without saying. You already know. People who don't know what to do or how to do what they're supposed to be doing is a source of stress. Because now I got to do my job and your job, okay? And I ain't getting paid for that either, right? Working in an environment which supervisors are not supportive. You can see that with your charge nurses sometimes. You can see that with your bosses, the nurse manager, director of nursing, where your DON or whoever's in charge is not supporting their staff. That could be a source of stress. Caring for a patient in cardiac arrest or a dying person. Now, caring for a dying person is not always stressful. It's stress when it's unexpected. Like if you know the patient is DNR, okay, and it's expected, that's different. But when the patient was not expected to die, they were full code, everything was going for them, and then all of a sudden they have a heart attack or they die, that's a source of stress for the nurse, because now you're going to be wondering, what did I do wrong? Was it something I did? What did I miss? Those kind of things. That could be a negative impact on the nurse itself. Experiencing conflict with peers. Please maintain professionalism at all times. Caring for a patient who is disengaged or non-adherent. Now, this ain't a stressor for every nurse. There are some nurses, listen, you want to be adherent, you adherent. If you don't want to be if you want to be non-adherent, it is what it is. Not all nurses stress about this, but there are some people who are stressed about it. Or being able to make the right decision. Teaching healthy activities of daily living, you already know this, we already talked about this, I don't need to beat this in the head. Stress management techniques, we already know. Relaxation, mindfulness, anticipatory guidance, and guided imagery. For example, let's say guided imagery. You could tell the patient, close your eyes. Imagine you're in a beach somewhere, and you hear the sound waves, and your favorite music is playing. Ooh, that could be an example of guided imagery. It does work, by the way. It does, well, maybe not always, but it does work. It worked for me one time, all right? And then crisis intervention, you gotta know with regards to crisis intervention, that is where you're trying to stabilize and keep everybody safe. The first and the main priority with intervening during a crisis is safety. Safety, 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 safety. You want to try to de-escalate the situation, try to get the patient to be, or the person, calm as possible, stabilized. You want to make sure you have a sound understanding of what caused the crisis in the first place, and try to make sure you are empathizing, not sympathizing, but empathizing with the client. And of course, you want to encourage effective coping, recovery from the situation that caused the crisis, and make necessary referrals. And this is, who does referral again? What role is what counselor? Okay, just making sure you're still there. All right, and then this is your evaluation, and boom, that is that. Okay,